Maybe we could make more specific on the kind of issues people could have. For example, I guess car wreck. Would that,
a car
those
wreck
kind of
would
things
be a good example, because often when people have had a car wreck, they might be doing okay and driving, but when they get to circumstances that remind them of their car wreck, for instance, if somebody was going down a windy road in a rainstorm and they went off the road, they might do fine on the freeway and they might do fine in town, but when they get on a windy road, they start to have sweaty palms and increased heart rate, things like that. So a car wreck, a grief or a loss issue that's not feeling resolved and not feeling like it's healing. Individuals who've had traumas as children where they witnessed something very dramatic or upsetting. Sometimes people who feel like they have had been exposed to domestic violence. Individuals who, right now we have a lot of veterans, and so if you've been exposed to war, or sometimes just watching individuals who've been to war and then returning and trying to get back into their family and let go of those traumas. EMDR is ideal for working with veterans of wars and of traumatic experiences. So types of situations like that. So really just a whole breadth of different things people could be dealing with in their life. Right, a crime, things like that. Yeah, crime victims, those kind of things. And you range basically childhood issues all the way to current things that are going on. Okay. Right. And a big piece of EMDR is being able to deal with that past trauma, deal with current triggers that are causing that trauma to be brought up right now, and then help the individual to look into the future and be able to address future issues without that same level of upset and disturbance. Okay. So, and really what I'm hearing in there is we can work with past issues, we can work with things that are coming up right now, and also we can kind of take it into the future to help future things. Imagine a situation where this has been a problem in the past. And how do you know where to go in terms of which issues you're going to work on? Well, that's very specific to your therapist and their clinical judgment. So the EMDR is completely within your therapist's good, sound clinical judgment. They're going to work with you and they're going to help you guide where you need to go and what you need to work on. So you don't have to worry about that as a client. That's something that your therapist will help you work on. Okay. When you work with a client, do you explain EMDR to them before you start doing it? I do explain EMDR to them, and I educate people in trainings like we've had today that people talk about EMDR in terms of how it was developed, to talk about the originator, Francine Shapiro, and how she discovered or stumbled onto EMDR. I have them explain some of the research about EMDR and how it's been developed with post-traumatic stress disorder. I help them to know that EMDR is, it's got sound research behind it, and it is a well-researched treatment. But I help them, I ask people in my training, and I help my clients to understand that EMDR is not a quick fix, that it's not going to immediately take care of problems. It takes a lot of work. I help the clients to understand kind of what it looks like. And we do what's often called a safe place exercise frequently with clients early on, where the client learns kind of a relaxation, has a relaxation experience with eye movements added in, so that they get a familiarity with the actual eye movements and get an experience of EMDR with a relaxation.